Welcome to my channel. If you're new here, don't forget to like and consider following us. Makoko, often called the floating slum of Nigeria, is a unique community built on stilts over the Lagos Lagoon. It's home to tens of thousands of people living in extremely challenging conditions. The situation in Makoko is dire, with widespread poverty, lack of access to clean water, inadequate sanitation, and limited healthcare. These issues contribute to a high prevalence of diseases, including sexually transmitted infections, STIs, due to poor healthcare access and education. The harsh environment, combined with poverty, leaves the community highly vulnerable to various health challenges, including alarmingly high rates of child mortality, living conditions, and poverty. Most Makoko residents live in makeshift wooden shacks over water, with little to no access to basic amenities like clean water, electricity, or proper sanitation. Fishing is the primary source of livelihood, but earnings are low and the living conditions are tough. Children in Makoko face malnutrition and a lack of education, which perpetuates the cycle of poverty. Health and disease. The lack of clean water and sanitation in Makoko leads to the spread of waterborne diseases like cholera and typhoid, with malaria being prevalent due to stagnant water. The overcrowded and unsanitary conditions contribute to the spread of infectious diseases, including STIs. Limited access to healthcare means many residents cannot afford treatment, resulting in high rates of untreated illnesses. Child mortality. Child mortality in Makoko is shockingly high. Malnutrition, poor living conditions, lack of healthcare access, and the prevalence of diseases put young children at significant risk. Many children do not receive proper vaccinations, and the local health system is inadequate to meet the community's needs. Government response. The Nigerian government's response to Makoko's challenges has been inconsistent. While there have been efforts to improve living conditions, such as plans for better housing and infrastructure, progress has been slow and sometimes met with resistance. In some cases, forced evictions have worsened the situation, displacing residents without providing adequate alternatives. There are ongoing discussions about improving Makoko's infrastructure, including access to clean water, sanitation, and healthcare. However, the government's efforts are often criticized as insufficient, with much of the support coming from NGOs and international bodies. The need for sustainable solutions. Addressing Makoko's challenges requires a comprehensive approach that includes improving infrastructure, providing access to education and healthcare, and creating economic opportunities. Sustainable development programs that involve the community and address the unique challenges of living on water are essential for lasting improvements. While some attention has been given to Makoko, much more needs to be done to provide residents with basic necessities and break the cycle of poverty and disease that has plagued the community for generations. If there's anything you'd like to add or discuss, feel free to share your thoughts in the comments. Don't forget to like and subscribe to join our community.